Carrie, and we found a nodule on my throat 3 years ago, and we had the nodule initially biopsied, and the biopsy came back that it was benign, so we were in the clear. The right side.
Right side.
On the right side. And so we were told that we just needed to watch it and keep a close eye on it. So every year we would go and I would have an ultrasound done on my thyroid to make sure it hadn't grown. And for 2.5 years it had not grown. But then it, at year 3, it had tripled in size, and they wanted me to have it looked at. And so my husband and I did research around Indianapolis and found out that Dr. Huntley and Sentinel was available, and you guys recommended us one of the best, and so that's what we went with. And I came to you, and they said that it needed to come out, and Steve and I had done research before we came in as to our assumption was it was going to be coming out, and I did not want to have it taken out through my throat. I didn't want the drains to be coming out of my neck, to be honest with you, because I have 2 young children, and I know that they had to stay in for a couple days, and I didn't want them to be frightened that something was going to happen to me. And I know coming in that they would see that, and not only that, but I'm young. I didn't want an incision on my neck for the rest of my life, and I didn't want everybody to know my health and my business, because an incision on your neck definitely lets everybody know that, hey, oh, she had her thyroid out, and to be honest with you, I didn't want that. Steve and I both let you know that that was the #1 thing for us, was that, you know, the precision with the Da Vinci was the key. Yes, they use it for open heart surgery, but whether I'm having open heart surgery or I'm having my thyroid taken out, the precision is what we were after. And that I want the best. The day of surgery, we came in. We were there around 6. Checked in, no problem. You came in and met with us. We drew to make sure that we were able to go directly to the throat. So other than having a marker prints on me, that was it. In case we needed to have the second incision, which of course we did not. But we were prepared. We went in. Other than that, the anesthesiologist came in, met us. We went back for the surgery. I woke up to Dr. Huntley standing next to me and the recovery nurse, and I was up in no time. I was able to call my office, I think 2 hours after surgery.
Started talking right away.
Right, I started talking clearly.
Trying to do work from the hospital bed.
I tried to do work from the hospital bed, and called into my office, and they were all couldn't believe that I was speaking. As far as pain, there really wasn't any. The only thing that bothered me was the drain, and I could feel the drain, and other than that, that was the only thing that bothered me.
You're how far out now from surgery?
6 months.
6 months out.
6 months out. No problems. I work out every day. I do whatever I want.
You were doing that a couple of weeks after surgery.
Right.
Probably,
in fact, we had surgery on Thursday, and the following Friday I took off to Florida.
That's right. Took a vacation. I
took a vacation, and I was in Florida for a week, and I had no problems. The only thing that you told me I wasn't allowed to do is pick up my luggage, which was no problem. So I didn't carry anything. That was the only limitation. And then after we got home, I returned to my everyday activities and no problems.
I forgot about that, a vacation like the week afterwards.
Oh,
yeah, I was not happy about that.
You were having a panic attack.
Yeah, you were gonna have a huge
You had a doctor down there that was all lined up, and you were like, no. I flew, no problems. I didn't have any problems. And Steve and I both said, he said, you know, if we ever had to do it again, that's the way we would go in a heartbeat again. Because it was, the recovery was very quick. My incision is about this big. It sits right underneath my arm, right in here. You can't ever see it, especially if my arm is down. There's no pain to it. That's my incision. It's right underneath my arm. It's right here. That's it. No nodule, no bumps, no nothing. It's good.
And voice is fine.
My voice is fine.
Yeah. Swallowing fine.
No problem swallowing. Everything's good. I eat what I want, when I want, do what I want, when I want. And you know me, I can just do whatever.
It's
easy.
That's her, yeah.
It's the surgery. It's a breeze.